All right. Give me a function of the kidney. Filters waste. Okay, which waste does it filter? BUN, creatinine. It does help with some uric acid or urea.
And a little bit of
A tiny bit of ammonia, right? The liver gets rid of most of the ammonia. But remember, when the liver gets in trouble, it's always going to be like, kidney, can you help me out? Yeah, okay. All right, so if it does that, okay, and that function breaks, so the patient's had a kidney injury, acute kidney injury, or they're in renal failure or end-stage renal disease, whatever it is, that function doesn't work anymore. So can we filter waste?
No.
So where are they going to build up?
Blood.
In the blood. Yes. Okay. This is like you with blood pressure. Yeah. Okay. So that means that in the blood, what are we going to have too much of? What? BUN, creatinine. So those are going to elevate. Go on. But just stay on waste for right now. The uric acid is going to build up. Now, uric acid will go into every part of your body and wreak havoc because it's going to try to find, like, I got to find somewhere to be, right? Okay. So it's going to build up underneath the skin and they're going to get, which is called pruritus. Pruritus is itchy, right? They may also call it uremic frost. All that waste is going to build up underneath the skin and they're going to itch everywhere. Okay. It also likes to build up in the chest cavity. That is called uremic pleuritis because this is your pleural cavity. So how do you think it feels when they take a deep breath?
Painful.
It hurts like all holy hell and they got chest pain. Yeah. It builds up in the mouth and that is called uremic fetor, poo breath. When they open their mouth, it smells very bad because uric acid is all built up in their mouth, builds up all in their face. And that's called uremic facies. Okay. So they get like a brownish discoloration to their face. Okay. Where does ammonia like to go other than the kidneys? Where's the other place it deposits? Huh? Brain. It goes to your brain and causes encephalopathy. Encephalopathy means like your brain is kind of swollen, not doing so good. Yes. Come to find out your brain doesn't like to sit in straight ammonia. This is shocking. How do you think they feel with all these waste products in their body?
Horrible.
Horrible. So they have malaise and fatigue and they're going to get frequent infections because basically their blood is full of, yeah. Yeah. We call it azotemia. What is azotemia? Emia. Blood. Okay. So it's a buildup of all the waste products in the blood. We call that azotemia. Do you understand?
Yes.
Okay. So how am I going to fix all of this waste? Got to get it out, but the kidneys can't do it. Dialysis. They're going to have to do dialysis. They're going to take out all of their blood, filter it through a machine and give it back to them all nice and clean. That's what dialysis job is. Obviously it doesn't take it out all at one time. That would be death. It's like rotating. Okay. But we need to watch these levels. So I'm going to watch BUN. I'm going to watch creatinine. I'm going to watch their ammonia levels, their uric acid levels. Oh, uric acid also likes to build up in the joints. What's that called? Gout. Okay. Oh, really? Damn. Okay. So if we're worried also about ammonia in the brain, then we need to do neurochecks and seizure precautions. Very good. Very good. There are 3 drugs that treat gout: allopurinol, probenecid, and colchicine. So if you see those on your chart, those are to treat and to decrease the uric acid in the body. Okay. What is a drug of choice to get rid of ammonia? We did this already.
Yeah, we did it.
Have we done GI or no?
No.
Oh, then I haven't done it with you. It's lactulose, which is, do you know what lactulose is? You've probably given it at the hospital at some point. It is a sugar, but it makes you poop. It's a laxative. Okay. And then neomycin is the other drug of choice. What is neomycin? It's an antibiotic, which makes you poo-poo. So they're trying to help you get rid of ammonia through the poop. That's much better than getting rid of it through kidneys or building up in the brain. So that fun fact, lactulose and neomycin, you will see on a million nursing school exams in lots of different ways. Those are the drug of choice for getting rid of ammonia and preventing hepatic encephalopathy or treating it. Okay. How do we know it's working?
Pooping.
You're pooping a lot. Okay. We are going to monitor this patient for asterixis. What is asterixis? No, that's hepatic encephalopathy, but it's a test to test for that basically. So asterixis is something like, okay, let's say I'm taking care of a kidney patient and they all of a sudden start getting confused. And I'm like, oh no, what could be happening? I literally just told you. Why would they start getting confused?
Oh,
Yeah, there's ammonia in the brain, right? That's encephalopathy. So I'd be like, oh, I need to see if they have an ammonia problem. Now I will draw an ammonia level, but that's going to take a while to come back. At the bedside, I can go to the patient. If you push back their hands and you let go, if they have high ammonia, their hands are going to shake like this. That's bizarre, right? So we test for asterixis. So I can be like, oh, I already know it's high ammonia. I'm going to go ahead and start them on lactulose and neomycin and get rid of that ammonia. Do we understand?
Yes.
Okay. What do you do for this problem? Antihistamines and lotion. And what do you want to do with their nails? Keep them clean and keep their hands. Because if they start scratching, right, and there's waste and stuff underneath, oh yeah, they'll get horrible skin infections. Do we understand?
Yes.
All right. Do we understand that function of the kidneys?
Yes.
Okay. Give me another one. Another function of the kidneys.
BP.
All right. So it regulates blood pressure. How does it do that?
RAS
Through the RAS system. Very good. So it's constantly sensing, the baroreceptors are sensing
low blood pressure.
low blood pressure, and it'll kick in the RAS system if it needs to. So what happens if the kidneys are broken? Can it regulate blood pressure anymore? So where does the fluid go?
Would it be third space?
No, it just stays in, it goes inside. There may be some third spacing. I do agree with that, but you're not peeing much. What's it called when you're not peeing much? Oliguria, right? Okay. So all that fluid is inside. So what's your blood pressure going to be like? It's going to be very high because they have lots of fluid left inside. Yes. Okay. If you've got lots of fluid inside, what's your biggest risk of hypertension? Stroke. Okay. And they're going to be in fluid volume overload. What's that going to do to their heart? Yeah, it'll make it go fast. It'll also put a lot of pressure on the heart too, right? So they could end up with, yeah, heart failure. Do we understand? This is a big deal. Yeah, we got to get rid of their fluid. I don't know why I can't speak today. I don't know what has happened to me. I feel like I'm in a brain fog for some reason. Okay. So what do you want to do for this patient? Fix the problem. How do you get rid of the fluid? You can give some furosemide, but their kidneys don't work good. So if Lasix is going to pull a bunch of fluid to the kidneys and the kidneys can't get rid of it, it's bad. So you will give some. Yes, dialysis will get rid of all the excess fluid. Okay. So what's the best indicator of fluid balance in this patient? A daily weight. We will still do eyes and nose, but daily weight is better. Yeah. So we're going to try to get rid of it with diuretics. Do you want to give them fluids? No. What are you going to tell them? You want fluid restriction, right? Because I don't want any more fluid, right? If their heart's having a hard time, where is that fluid going to back up to? The lungs. So what do I need to be real serious about doing? Auscultating for crackles. That's very important. That needs to be reported because if there's fluid sitting in the lungs, what's going to happen to it? It's going to get infected. They're going to get a pneumonia. Yeah, which is really important to kind of note, eh? Okay. So if we're worried about stroke, we need to put them on neuro checks and seizure precautions. Yeah, we're going to check their blood pressure really carefully. And then they do dialysis typically 3 days a week. Monday, Wednesday, Friday. Got it? All right. Next function of the kidneys.
Electrolyte balance.
All right. So which electrolytes does the kidney balance? Sodium, potassium, chloride. All right. So that's the main ones. Now it will help out if the other ones get in trouble, right? Like which electrolytes will it help out with? If they get in trouble.
Calcium.
It'll help with calcium. It'll also help with MAC. Okay. Do we understand? So, okay, cool. All right. So if it is not able to balance electrolytes, your kidneys are broken, then what electrolyte imbalances will we go into? Hypernatremia, hyperkalemia, and hyperchloremia. Oh, I forgot to put chloride up there. Huh?
I was going to say hyperchloride.
Chloritis? What? All right. What's the first thing you're going to do for hyperkalemia? EKG. Yes. And then we need to bring down that potassium. Give me the 6 antidotes for hyperkalemia. I told you it's coming for you in every module. K-exolate, which is called sodium polystyrene.
I know what it looks like.
Okay.
I can't say it.
Sodium polystyrene. Sulfonate. Okay. Y'all need to write this down 10 times. 10 times you're going to write this down because this sucker is coming for you. Okay. K-exolate, which is the actual antidote, right?
Yes.
Is called
Sodium poly. That's where it gets me.
polystyrene
Sulfonate.
Write it 10 times on a piece of paper somewhere. Because I'm telling you, it's coming for you. You will have it on exams like mad.
Every pen I grab somewhere.
Huh? All your pins aren't working. If they're broken, can you chunk them?
Yeah,
Okay. All right. We in Catholic school today.
Have you seen the acronym I saw on TikTok?
What? Acronym for what?
Potassium incidents.
Oh, no, I haven't seen them. Sure.
It's called DIC.
Oh. We'll just talk about it in a little bit. Okay. Okay. Oh, I see it now.
Mhm.
Okay. Well, there's two more. So.
Well, yeah. But
Okay. Oh, I see.
it was like if you need, like if you don't know it and you like it's on the test or something like that. She was like, these are helpful. She gave you the other ones. It was a TikTok.
Oh, okay. You know how TikTok is.
Yeah.
Yeah,
I'll send it to you.
We'll do it. It's fine. And we can add the other ones too. Because I think I have an idea. How we doing?
Hands right.
Oh, now you want to learn your lesson today.
That's like ISS. You can have that.
ISS. You learn ISS
Yeah.
in school suspension.
Yeah.
Oh, I was really bad.
You were?
Yeah.
I can't see that.
My dad beat my ass, so I was like trying to get attention.
Oh.
I asked my teacher if shit was a cuss word just so she could see me. No, but she was really, so it was like the last day of school and she was like, I don't want to see anybody putting anything in their toe tray. I was standing right next to it and I slipped my ruler in there and she dumped my whole toe tray in my arms and was like, you're carrying it the rest of the day. And I was like, you got fucked up. So she was like, go to ISS. Like I was friends with the freaking principal. That's too much I was there.
All right, you ready?
Mhm.
Okay, so I added this because
Okay.
add dick. Okay. So what is, give me some of them. These are the antidotes to hyperkalemia.
Albuterol.
Albuterol,
Dialysis.
dialysis.
Extras.
D50.
I'm guessing that's what they're doing here.
That's what she did.
D- 50 plus
Yeah.
insulin.
Yeah.
If they're non-diabetic, right?
Yes.
Okay. And then C,
Calcium gluconate.
calcium gluconate. Oh, we about to get real weird in here because you're gonna need to add dicks. You perverts. All right, what's the K? K-exolate. Sodium.
Polystyrene.
No, that's K-exolate. There's another one.
Oh, sodium bicarbonate.
Yeah.
Yeah.
Yeah,
We
had to
were
take
just practicing saying it.
Excuse me?
We were practicing saying.
Oh, okay. Good job, everyone.
Yeah.
All right, so those are the antidotes. We're gonna do that. Okay. What's your keyword for potassium?
Heart.
Heart. So we're gonna check EKG. What's your keyword for sodium?
Brain.
Brain. So you're gonna do
Neuro.
neurocheck, seizure precautions, and hyperchloremia. We kind of don't worry so much about. Okay.
Got it.
Okay. So you want them on a low sodium, low potassium diet.
Yes.
Yes. Cool. All right. Give me another function of the kidneys.
Acid base.
Yeah.
Acid base balance. All right. So the pH of your urine is low. It's very acidic, right? Because your kidneys are constantly sensing how much acid you have in your body, and you're like, oh, you're so acidic, and then it will spill that acid into the urine. Does that make sense?
Yes.
Okay. So if that breaks, what happens?
Then you wouldn't have a lot of acid in your pee.
So where would it be?
In your
Blood. So you're going to get very acidic. You're going to go into what? Acid base imbalance. Metabolic acidosis. Very good. That was very simple. Yeah.
Yes.
Okay. When your kidneys break, who kicks in to help? That is not true. when you're talking about acid-base balance, there's
Oh.
only two systems. There's your kidneys and there's your
Lung.
lungs. Okay, so in your lungs, what is the acid?
CO2.
CO2. What's the base?
Oxygen.
O2. In your kidneys, what is the base? Y'all know it. I should have just wrote it up on the board. I literally just wrote it on the board.
Sodium.
Sodium bicarb. Sodium bicarb is your base. What's your acid? Hydrogen. Okay, so those are your two acid-base systems, and they're there to help each other. So if one breaks, the other one kicks in. Yes?
Yes.
Okay, so right now, what's broken? Your kidneys. So who's going to kick in?
Lung.
Your lungs. So how are they going to get rid of the acid?
The breathing.
Yes, Kussmaul's breathing. That's deep, rapid breathing. They're trying to blow out the CO2. Do we understand? So you may see Kussmaul's breathing. I'm telling you, I'm not okay today. I don't know what's wrong with me. I'm like super cloudy at it. And I'm just like, "Meh." Okay. So what's the nursing care for fixing this acid problem? No, because that's just the fixing system, right? We need to actually fix the system that's broken. So what can we give them? You can actually administer sodium bicarb, which is a base. Won't that help a little bit? Okay. And then I need to draw ABGs, right? Arterial blood gases that I know what their pH is. Yeah? Okay, give me another function.
Oh.
So far you said filters waste, regulates blood pressure, balances electrolytes, and acid-base balance. We have two left.
Religion.
All right, produces erythropoietin. What does erythro mean? Red blood cell. Poietin, to make. So erythropoietin makes red blood cells. What starts the system to make red blood cells? Hypoxia. Okay. So in the kidneys, they make erythropoietin whenever you need it, right? When your body's like, oh my God, you need some more red blood cells, you know? So, but if this function is broken, are you making erythropoietin? Okay, so let's follow through erythropoietin. Erythropoietin's job is to tell the bone marrow to make more red blood cells. So if you're not doing that anymore, then
Hypoxic.
they may be hypoxic because they're going to be
No.
Anemic.
anemic. They're going to be severely anemic. All of our kidney patients are very anemic. Now, yes, they do have a risk for hypoxia. Do not get me wrong with that. But they're not all walking around like that, right? They're just anemic. Okay, how do I know somebody's anemic? Yes, but how do I know for sure? How do I know for sure? 100% for sure they are anemic. What blood test would you like to do? Hemoglobin and hematocrit, right? That's how, y'all, we did like a whole 4-hour session on effing anemia. Okay. All right. So we're going to draw hemoglobin and hematocrit. What else do you want to do for our patient for anemia? They do not need iron. They are not deficient in iron. Remember, we talked about with anemia, there's lots of different anemias. You have to match it up to, I know you really like iron though. You just love the shit out of iron. Oh, okay. Go on. How do they feel? What's a treatment? What's a nursing care for anemia?
You figure out, you treat the underlying cause.
Okay, well, the kidney is the problem and I can't fix it. So how do you think they will feel? Really tired, right? Because they don't have enough oxygen, right? Frequent rest periods. And if their risk is hypoxia, I probably want to monitor that with a pulse ox. And if their hemoglobin goes less than 7, if they go very low, yes, you can give them O2. We may need to give blood transfusions.
Oh yeah, that lady. I was gonna answer her hemoglobin was 8.3.
Oh, nice.
So they were.
Did they transfuse her?
They said that they had it on standby.
Yeah. So most of the time they won't do it until at least less than 8.
Yeah.
Some hospitals go less than 7 before they'll
Mhm.
transfuse. Okay. Do we understand that function? All right. We got another one. One more. It's a vitamin.
Vitamin D.
Yeah. All right. So it synthesizes vitamin D. Okay. What's vitamin D's job?
It's just a marry with calcium.
It marries with calcium to help absorb calcium. It also has major immune function, right? Because vitamin D is really more of a hormone than it is a vitamin. Yeah.
Oh yeah.
Okay. So if they're not producing vitamin D because the kidneys are broken, then what happens? Why?
Hypocalcemia.
They have hypocalcemia, which means they're also going to have hyperphosphatemia. Yes.
Yes.
So yes, they're at risk of osteoporosis. They may have frequent fractures. Yeah.
Mhm.
What's the disease called where you have deficient vitamin D?
Rickets.
Rickets. Rickets. Yes. Okay. All righty then. So what am I going to do for this patient?
Give them vitamin D.
Yeah. And
Would you give them calcium?
you would
Yeah.
give him calcium too. Vitamin D and calcium.
Okay.
What kind of exercises?
Weight bearing.
Weight bearing exercises. I need to get rid of that phosphorus. So we're going to give them phosphate binders. Those are medication you can give that grabs the phosphorus and helps you get rid of it. It is called Phoslo.
Yeah.
Yeah.
That's
All right.
nice.
That is nice. Thank you, Lord.
Mhm.
All right. We want them on what type of diet
Low.
in this function? So yes, hold on to that. So we want them on a high calcium, low phosphorus, but they cannot have dairy because
Mhm.
it has both, right? So there's no dairy for any of our kidney patients, right?
Yes.
Right. Okay. Do we understand all the functions of the kidneys?
Yes.
Now, what we're going to do when we start going into AKI is all of these right here are signs and symptoms of your AKI and CKD. This is it, all in one page. All the signs and symptoms and all the nursing care of AKI and all the nursing care of CKD all on one page. Do you understand how to do this?
Yes.
Okay. So that's your whole plan of care. That's one whole PowerPoint in one page. Enjoy. All right.